Dental assistants love what they do, but they're not respected in the role that they play.
There's this thought when I hire an assistant that the assistant doesn't seem to want to stay an assistant. They want to either go up to admin, which I don't know if that's an up, or they want to become a hygienist.
They're not treated with the same respect as the hygienist. I feel often it's because we're not getting the top dollar or the respect that we want. So we feel like, okay, I have to be a hygienist. Whether they like being a hygienist or not, they know it comes down to making more money.
Workforce is awful right now. If we have more of a shortage of assistants, we're royally, for lack of a better word, screwed. Say I land a great assistant. How do I keep you in the office? And we are back. Another edition of Nobody Told Me That. And I have, a longtime friend in the industry, Julie Varney, who's like assistant extraordinaire, right? What's going on, Julie? How are you?
Good. How are you? Not much right
Okay.
now. The weather
Yeah.
is nice. Offices are busy. Dental conference season is in full effect, full swing, right?
Yep.
Not really much. Not really
Other
much.
than all of that, right?
Right.
So when Julie and I get together, and which is hit or miss, because sometimes like we're at the same place and sometimes we don't see each other for years, which is what happened. Like we saw each other at Chicago Midwinter, and it was like, oh
Mhm.
my God, when was the last time we saw each other?
I
We have
can't. I think
so
maybe an
much.
ADOM meeting. Yeah.
Yeah, years. So here's what I really love about this industry is I can pick up with people and it's like I never left off, right? So
Mhm.
here's what I turn to people like Julie for is, okay, she represents assistants. How on earth am I supposed to? I was an assistant, I was a terrible assistant. So I can't say I relate to assistants like I used to. I am struggling now. I get a lot of people saying workforce is awful right now. If we have more of a shortage of assistants, we're royally, for lack of a better word, screwed.
Yeah.
Because who's going to do the assistant's job? AI is great, but not for an assistant. I guess it's not going to happen. So, say I land a great assistant. Let's just jump into it. We have a lot too. And then I want to go over because it'll sprinkle in why you're the person I go to for this. How am I keeping you, Julie? How do I keep you in the office? How do I make sure you understand this is the place to land? And I want to put a caveat on that for everybody. I'm not trying to keep Julie because she's the only assistant in town. She actually is a great assistant. So I don't want you to keep someone
Mhm.
who's terrible. That's like terrible advice.
Right.
But how am I keeping you? I identify that you fit with the team. How am I keeping you, Julie?
First thing I say for myself, and I know for many others, it's respect.
Okay.
I am treated with respect. I am understood. I'm heard. I'm giving the tools to be successful chairside. I'm not belittled. I'm not yelled at. I'm not having instruments thrown at me. I'm not having my hours cut because there's no patients in chairs. I'm not having the hygienist, tell me what to do, when to do it, and how to do it. I am just a part of the team like everybody else. I am equal. I'm valued. Everybody is in sync. And I'm elevated to the next level that makes me feel like this is my dental home. This is the career for me. This is how I want to be. I want to be better than the next day. I want more education. I want to be able to do more things. If there's things I could be licensed in, I want to be that person that doctor can always count on. And I
Okay.
think
So
often it's not found. It's not, dental assistants love what they do, but they're not respected in the role that they play.
which is
So,
it's really hard to hear that and because number 1 I know it's true, but number 2 there's such a dynamic in the office where there's this thought when I hire an assistant that the assistant doesn't seem to want to stay an assistant. They want to either go up to admin, which I don't know if that's an up, or they want to become a hygienist. And I feel
mhm,
like there's a lot of doctors out there that say this is a real temporary position And I don't see that. I've always been impressed by people like you and Stacy Singleton and Shannon Pace Brinker who see it as a career, not a
Mhm.
stepping stone. Is that why doctors treat it that way? Like they've just seen so many people move from there? Or like, where do you think that comes from?
I think it stems with having that doctor place value on the role. I
Okay.
think it stems from ones that get into the profession of dental assisting, whether they're on the job trained or have schooling, and they're not treated with the same respect as the hygienist or the front desk.
Okay.
And then they're like, well, then I need to be that role to be respected. And I think
Okay.
that's where it kind of stemmed from. I don't think, or you know, the dentist says, well, you can make more money by being a hygienist. Maybe they implant that into their head when they're
Yeah.
not really thinking, okay, this could be your career longevity. Let me build up your skills. Let me give you the education and you can make more money. So I feel like it stems from the role is really not valued. So, and they're not getting paid what they want to get paid. Now, will we ever be paid a hygienist? Maybe someday. It depends on lots of things in that wheelhouse of education and licensing and national standards. So I feel often it's because we're not getting the top dollar or the respect that we want. So we feel like, okay, I have to be a hygienist. Whether they like being a hygienist or not,
Yeah,
they
that's
know it comes
interesting.
down to making more money. It's the bottom.
Okay.
You
Okay.
the bottom line is the more money part. And for me, it wasn't always like that. I always loved being a dental assistant. I've always, was it the best pay at times? No. I mean, when I started, it was 3.75 an hour. I mean, and the next guy offered me 11.50 an hour, and I was like, I'll be there tomorrow.
Right?
Okay, and I stayed there for 24 years. And now I'm like, telling these younger assistants that, maybe go through programs or get on the job trained is like once you get your skills and your foundation of education and your license for your state, you should not be making what McDonald's workers make.
Yeah, no,
You
I
should,
yeah.
it's healthcare and we don't treat it like healthcare sometimes our role,
Yeah.
if that
I
makes sense.
No, it makes total sense, and I feel too that I'm not sure how much pricing managers and doctors do of the industry, but it is very common for a doctor to say, "Yeah, I lost my assistant because she noticed she could make this much more at Target and it's less work." And I said, "First of all, it
Mm-hmm.
is less work. Like, I see assistants, you guys are run ragged, right? Even
Mm-hmm.
if you have super systems, like, the busier it gets, it still can fall apart. All it takes is one of your colleagues to call in sick, and now you're, like, stressed the whole day.
Right.
And it's
Right.
physical, it's very physical, like, my brain will hurt after a day of insurance, but my arms and back won't hurt, so it's very different. Now, you said tools, let's talk about that. You walk into my office, and I want you to be honest here. What do you look around and see and you're like, "I don't know. I don't this is gonna be tough." Like, what makes you think, "Not the office for me?" I'm just wanting to know.
I look at a lot of things, and I do this sometimes with my own practice. Like I walk in and I look at the floor if it's clean and neat. I look how people are dressed. Are they all dressed different? I'm kind of a big believer in that even the front office needs to wear scrubs or match the team. Like we are all one unit.
Okay.
Nobody should stand out above the rest. So we all have matching scrubs at my office. Monday, Tuesday, and Wednesday are different color. I
Nice.
look at the behaviors between people, like when they're walking out patients and handing them off to the next patient or the next provider. And how is the air around them? Are they, oh, blah, blah, blah? Or are they like, here's and they're just attitude. And you can tell they don't really kind of get along,
Yeah, yeah,
and then I look at the patients, are they interacting with the team? Are they just, oh, thanks, and they're out the door? I mean, if you came to my office, we have Miss Cassie up front, and sometimes the patient doesn't get to leave because they're talking and it's like they just saw their long lost best friend and they have
yeah.
to carry, she's got a new baby. So show them pictures or they
Oh,
ask,
okay.
and just the rapport or how is the doctor responding to things that are going on, being pulled into different directions. So that's why when I tell the younger generation, when you interview, ask for a tour of the office, ask to look at these things. Don't just go in a cubby and meet with the dentist and the office manager because you're really not going to see things in real or hear things that, oh, look how they talk to each other.
Yeah,
You know,
yeah.
and then you're like, do I really want to be talked like that? Well, if they're doing that to people that have been here a while. And then I also ask longevity. One of the things I ask is, how long has the team been here? So in my office, I have Sarah, 23 years, Leah, 16 years, Cassie, 7 years, me, myself, 9 years, and
Mhm.
Heather Lee, she's the new assistant. She's been there 2 years. The other one before her was there for 10 years. You ask these things.
Yeah.
And I think it gives you a good picture of like, what are you walking into? Because it can be the best looking dental office, all the latest equipment, which we have. But
Mhm.
our office is a little Victorian, a lot of woodwork, very like 80s, 90s. It's bringing into the modern, but we have all the latest technology. But if that office is, brought into 2026 and it has all the beautiful furniture and
Yeah.
are they just putting a Band-Aid on something? Like,
Yeah.
looks aren't everything.
Yeah. No, and I have definitely walked into gorgeous offices and there's this big, and this is why if you ever want to be a consultant, this is really important. The first day you go in to observe a team, it is the best you're ever going to see. Like they're going to put on the Ritz and it's going to be like, oh, this team is amazing together. The next
Mhm,
day, for some reason, they think they've already shown you the best, and you really get to see the dynamics there. Maybe they're a little bit tired of doing a whole day of we're the best team. You're not going to see, So it is important what you're saying, like
mm-mm,
hear the little attitudes and little conversations. Listeners, this is why I wanted to have Julie on because she spent a long time. Like if you go back and listen to the podcast episode with Stacy Singleton, she's educated a ton of new assistants coming up. Julie has too
mhm,
for a very long time. I mean, you have been doing
mhm,
this as long as I've known you. I've always had assistants at heart. You are teaching. If you go back and look at her social media, and I'll put links in the show notes, she's having conversations with her students. She's having conversations with, the people that are going to be hiring her students. When you are sending your new people, your new Julies out
mhm.
into the workforce, right?
Yeah.
What do they come back and say to you? Like, you should have told me about this, or you warned me about it, but I didn't believe you. Like, what are you hearing? What's the
Mhm.
feedback?
A lot of times I hear that they're happy, but it's very chaotic and they're not
Okay.
used to the chaos or things go wrong and it's not handled properly. Often I'm getting messages or, well, Sally Sue did this, but they wouldn't show me how to fix this.
Oh, interesting.
And I find it interesting because we're all about constructive criticism and helping people be better. We
Mhm.
help people be better with their smiles, their teeth, their gum disease. Why aren't we helping our teams be better? So often
Mhm.
I hear, well, I didn't do this right or I'm not catching on quick, but nobody is helping me. They're lacking the help to grow. And in this profession, things like, it'd be like you working with a new front office and you've got 10 new codes coming out. And you're like, I'm keeping all these codes to
Right.
myself. She can fumble by herself. She don't need to know these codes.
My
You
codes.
know, they're my codes. Even though the ADA puts them out, they're mine. And I'm not going to tell her when that claim rejects.
Right.
It's like
Yeah.
this, I don't know. And I know, and I see it in forums, the seasoned DA. I am a seasoned DA. I am over 50.
Mm,
I am they always want to do it their way. Well, at my age, we need to be adaptable too.
of
We need to
course.
help the younger generation. Yes, we can show them our old dog tricks of how to do this or how to do that our way, but they might have learned something new.
Oh,
They might
yeah.
have learned how to do something different. And how about you embrace that and be like, oh, really? You used to do this? Oh, wow. You don't mix cements that way? There are lots of
Oh, yeah.
ways, as they call it, skin a cat. And nowadays, with everything with dentistry involving, like you with AI and processing claims, okay, you could be like, oh, paper was the way. I'm always doing it paper.
Yeah, right.
And
Good
the
God
new person
forbid.
be like, yeah, but I did electronically and it took 2 seconds and we got our money in 30 days.
Yeah. It's so funny because you're right. You and I are around the same age. You're a little younger than
Yeah.
I am. But what I hear all the time is there's people like us where we have worked next to seasoned people who don't want to give up. And I call them the dinosaurs, like the dinosaurs at the
Mhm.
front office. And, when I work with corporations and they're like, how do we get past your people? And I'm like, you mean the
Right.
dinosaurs? And they all know what I'm talking about. You have
Mhm.
dinosaurs too in your profession. So are they resisting like the scanners? Are they resisting
I
implants? Like, what are they resisting on your end?
I don't know what they're resisting. I don't know if they don't like younger generation coming in on their turf. I don't know what it is. But my biggest thing that I've always taught my students, and I always say before, is dentistry, you have to be adaptable to change.
Yeah, of course, of course.
Dentists, for one, the dentist changes their mind like they change their underwear. One day we're doing this, the next day we're doing it a different way. We're using one cement, now we're using this cement. We're using this bar, we're using that bar. So
Mhm.
it's a very ever evolving, changing profession. So you can't be set in your ways.
Yeah.
You
Yeah.
can't, the only time I say you can be set in your ways as long as you're doing infection control absolutely perfect and properly. But other than
Mhm.
that, passing instruments, setting up, using a cement, it's all going to change. And you can't be, well, in my old office. Well, you're not at your old office, you're at this office. So this is how we do things. So I think a lot of it is they don't like change. People are get set in their ways.
Yeah, and I mean, I am too, but if someone's gonna show me a way to do it better, like, maybe I'm not
Mhm.
set in my ways. I don't know. I feel like, yeah, show me, my goodness. I mean,
Mhm.
here's one thing. When we bring in someone, what you just said triggered me. We did it in our old office. Like, when I'm training somebody from another office and they're new in our office, like, you have 3 times to say something like that.
Mhm.
I'll say, "Okay, first time I hear it, I know, and I wanna hear from you about that later, but let's train you on our way right now because I need to get you up to speed, and
Mhm.
then when you see efficiencies, I wanna hear it." So, that's the first time. Second time, similar conversation. The third time, I've had it because I am just done. If you're gonna constantly
Mhm.
wanna do it your old way, why the heck did you even apply? So I get
Right.
a little verklempt about that.
Yeah.
But so as far as change goes, I think you're absolutely right. It may not be the procedure, it may not be the material. It's the fact that now you have to change the workflow. And now Miss Dinosaur, who always knew what was going on, now doesn't know what's going on.
Right.
Yeah.
Right.
So
And
that I
now
think you're right about that.
and they also feel threatened. And there is, they feel threatened from a newbie coming in and
Mhm.
kind of changing their ways, or maybe the doctor might like them better because they may be faster, they might be neater, they might be this. And
Mhm.
then there's also the part of they know that they worked really hard to get up to this point to make that hourly. And now this new assistant who has less experience is coming in at the same rate.
Yeah, but we gotta let go of that.
And you do,
You
you
gotta,
do,
like, I mean, you started
you
at what, 3
have to.
something? I
375.
started at 4, and, I mean, when I remember having to hire the first receptionist at something like 15 an hour, and I remember thinking, "The hell?" Like, it took me that
Mhm,
long to get to 15, and now she's coming
mhm.
in, but the market is different, the economy is different, like, get over it.
Easier for me, it's interesting because you're in forums just like I'm in forums, and we see these types of conversations where they're like, "Oh, and the new assistant or the new person was hired at the same rate, $1 less than me, and blah blah blah." Well, you've also been doing it a lot longer.
Mhm, and
Mm,
what have you done lately is what I always wanna push back with,
right.
because I can tell you the dinosaurs in my side of the industry, they're
Mhm,
the ones who are quick to say, "I don't need to take an insurance class every year. I don't need to. I've been doing this for 10 years. I've been doing this for that."
mhm.
Okay, what's your clean claims rate? How many days to pay? All this stuff, and they don't know their numbers. So for me,
Right.
knowing it is half the battle, but making sure that you're doing it well and being accountable is the other side of it. And I don't
Yeah.
know if our dinosaur people are up on that, you know?
No, and I think it'd be like me going into an office and getting hired, and I'd be like, "I want $42 an hour." And they saying, "Oh," and the younger assistant that's been there 5, 6 years says, "You're getting more than me, $42 an hour?" Well,
Mm-mm.
yeah, I got more experience. Well, I have worked here. Well, it doesn't matter if you've worked here. You have to earn, I'm a big believer you have to earn your keep.
Yeah,
You
for
have
sure.
to earn in your way of if you want more, learn
Yeah.
more, grow more, bust your butt more, and it will all work out, but it's going to take you, it's not going to happen overnight, but
Yeah.
you will get there. So,
So let's talk about education. Let me ask you this. So, as an office manager, I
mhm,
was always in charge of making sure everybody had education all year. All
mhm,
right. So, it was much easier to find education for the doctor, as we know. It
right,
was getting easier to find education for me because as I was evolving in the practice, there was more practice management.
right.
Man, the only classes I could find for you guys was infection control and OSHA. And I know
Mhm,
they were like another infection control class because there weren't a lot of you out there doing the hands-on workshops. Now there are, but
Right.
still not enough. So, say
No.
I wanna send you to classes. I'm gonna
Mhm.
ask you what kind of classes you want, obviously, but when I'm out there, like, what classes should an assistant be taking on a regular basis to stay up on things? Like, what types of classes should they be taking?
They should be taking classes. I work in a general office and the modern technology classes. If your dentist has all the modern technology, you should be taking classes, whether they're free or paid. And I know that's a big issue with people like, well, I'm not going to pay that if they're not going to give me more.
I think the doctor
Well,
should pay for that.
the doctor should pay for
Yeah,
that.
why
And
wouldn't
even if they
yeah.
don't, if you can find a way to take the class or pay for yourself, I think it shows a little bit that you really want to be better, that it's just not because you're getting paid to do it or it's been paid
Mhm.
to do it. But the modern dentistry, the 3D printing, the CBCTs that are coming out, I just signed up and the class was not cheap. Class was about $1,400 to
Oh
take
my
a
goodness.
CBCT course because
Wow.
I wanted to know as a assistant when my doc pulls those up, what am I looking at? I can see the
Mhm.
skull, you can see the teeth. So there's a little weekend course that I'll be taking, but I really think that you have to keep educating your brain in perfecting your craft. I mean, and people do it, welders do it, EMTs do it, nurses do it. People that have, and I call dentistry a craft, that dentists do it all the time. They're the first ones that take all that continuing ed, right? Because they want to be better. What about us? What about the front? What about the hygienist? The sterilization tech. There's a great boot camp with ADS that they could take to be better at processing instruments and know
Yeah.
all the latest and greatest stats and statistics. So I think, you know, that educational part is for me is a must. As a dental assistant, you just can't one learn on the job or learn in school and think you know it all because you don't. I learn something new every day.
Every
On the
day. Yeah, and
I,
that's why I'm surprised by people who I mean, you and I get called experts. I don't feel like an expert because every
mm-mm,
day I'm like, "Oh, I need to add this into my class. Oh, I need to add
mm-hmm.
this into my class," and, if
Yep.
I'm finding these little nuances, what else am I missing? So I can only bring what I know, and it's a struggle for the both of us to keep up on a lot of things.
Especially now, I feel like it's so fast paced. I think things
Uh,
are changing very fastly.
much faster than what you and I are used to, and I wanna talk about that in a second, but you said ADS. Tell me about ADS and what is this class that you're talking about? Because maybe somebody's listening that think is wanting to do that.
So ADS is the Association for Dental Safety. And for, I think it's $120 a year for your practice, you can get a membership for, I think it's up to 10 people in your office, where you have all the resources to infection control, infection prevention.
Very
Are you
reasonable.
doing things? Yes. It's a great organization. And if you are any type of office that hires an assistant on the job, and has no infection control, because that's the spread of disease, right? We're trying to stop the spread of disease. We can teach so and so to process a claim and it's not going to hurt anybody. You might not get your money right away, or we could teach them to pass an instrument or mix a cement. And that's really not, but that infection control part,
Yeah, that's
if
that's
you
lives.
do something wrong or you don't clean right or you don't process right, you could change someone's life for a long time or you don't test
Mhm.
your water. So they have like a little boot camp session in January and then they have an annual conference that gives you all the latest of what the CDC says or
Oh, that's
what your
great.
state might said. So it's a really great organization and it's not that expensive to join.
That's very
To keep your
affordable.
practice safe. Yeah,
Oh my
very affordable
gosh.
and
Yeah.
know what's right or wrong.
Yeah, that's great. Okay, so ADS, and then what about communication skills? Like, I know you've taken
Mhm.
them. Like, what type of I mean, they're doing probably helping with treatment presentation and treatment confirmation, going over
Mhm.
what needs to be done. Were there any kinds of classes you found useful as an assistant in that vein?
Yeah, I took a lot of communication, like how to talk to patients, how to understand treatment planning, how to hand them off to the next person. The first dentist I worked for a long time that I retired from in that practice, I'll never forget, he threw me a dictionary.
Oh god. Really? What are you
He
supposed to do with that?
he used to pull me in his office, excuse me, out of the operatory into his office and he'd be like, "You can't talk like that. We don't talk like that." And I was young. I was, 20, young whippersnapper, and I was like, "I know it all." And he'd be like, "No, we don't talk. You don't talk like that. Here's a dictionary. He's like, you're saying things wrong, your punctuation. And when you talk to a patient, this is how. So I started writing down how he said things. And I would memorize, like if he talked about a crown, how he wanted it to deliver. So I learned how to like kind of like a transcript.
Mhm.
And so that eventually when a patient would leave and ask you something, I could just say it and he'd be like, that was a good job.
Very
Because I,
nice.
listened to him and sat and listened to him about the treatment. So communication and how to work with different personalities.
Amen to that, my gosh.
Yeah,
Yeah, and that I didn't embrace early enough in my career, and that I
me
just
neither.
didn't think it was that big of a deal, and boy.
Nope. And earlier on in my career, I think there were some times that I was probably the mean girl because I was young. I had older people tell me what to do, and I was like, no one's going to tell me what to do or how to do it.
Yeah.
I'm the only assistant here. Just stay out of my, or do your own instrument, So I really
Mhm.
sometimes was not a nice person to work with because I thought I knew it all. And I thought, this is how it was. And people and we went to a couple community. I'm like, okay, we can't do this. And we had some disc assessments and all that stuff that makes you better at what you're doing, right?
Yeah, and
So,
it's hard to accept that, like, maybe the way you do it wasn't ideal. I mean, I say in my
mhm,
classes all the time, I'm a recovering queen bee because I was like, my way or the highway, and it works, so why aren't you doing it this way? And it was
mhm.
really I look back and I think, "Man, what a total bee I was." I mean, the real bee, like, awful,
Well, and
and
we also, onto our part, the way we did it, knew we worked. Like,
yes.
we knew the outcomes of the way we did it, and I think for me, it's sometimes I don't know the outcome if you're gonna change the system and how it's
Mhm.
done and why you're doing it, so I have to just kinda let go, and I laugh now thinking about it is because we had a assistant leave a couple years ago to work full-time. Sometimes you don't have full-time in offices,
Yeah.
and, we were sad to see her go, and then Heather Lee came on, and she's a past student of mine, and I said, "This is your area. However you wanna have it, have it." And she's like, "Oh," and I don't think most of the time, you don't get that. I'm
Yeah.
like, "If you wanna move that, you wanna move that, just let me know where things are. Just keep it neat and organized. Keep the tub system. I don't care how you have the tubs, but we have tub systems for every procedure."
Mhm.
And so now she calls me mom. She's like, I texted her yesterday because I was at the office and I said, "Hey, I took care of your sterilization so you don't have to worry about it money." She's, "Oh, thanks, mom." She's like 28 years old. I'm old enough to be her mother.
I was gonna say, now we are at that point, and there's people in my classes that they were born after 2000, and
Mhm.
it's so terrifying to me, but
Yeah.
it is what it is. Let's talk a little bit about that, though, because you started out as an assistant, and then you speak, and then you went into teaching, and you opened up programs. What
Mhm.
happened? What happened here? Tell us about the life of Varney, and what the heck happened in
So
life of
I was
Varney?
an assistant for many, many years. And I think how we met was in 2006, I became an office manager.
Mhm. Yeah.
Slash assistants because we had a smaller office, so I kinda did both roles still, and I joined ADOM, and that's where I
Mhm.
met you and started to learn how to be a practice manager, and then in 2007, my boss was like, "Let's open a dental assisting school." I'm like, "What? Oh my gosh, we can do that?" So we opened up a school in our state, in our area, and I did that for 10 years, taught dental assistants in our area. I think I had, like, 482 graduates over the
Wow.
10 years.
Wow.
In 2016, there was a lot of changes going on in my office that I didn't like. My boss was being a consultant junkie,
Oh,
and we had gone through several consultants to kind of put it as the magic pill to make things better
yeah.
until we didn't look in the mirror that it actually wasn't your team or their processes. I finally said, "You know what? I've had it. I need a change." And at this time, I was like big part of ADOM, and I had done like little speaking things. We had events here. I had a
Yeah.
couple events that you came to, and I saw my friend Ruben. He works at IT, owns Dark Horse Tech, and I said, "Hey, can I come work for you?" And I was just joking. He's like, "Well,
Yeah.
what do you want to do?" I'm like, "I would like to train on infection control and HIPAA and OSHA." And he's like, "Okay, you're hired." And so I went to work for them a little bit, and it really didn't work out as well as I thought it would. I mean, he's
Mhm.
a great company. Don't get me
Yeah.
wrong.
Yeah,
I
you
just
still
thought it
recommend them. Yeah, I still
yeah.
say you recommend them, yeah.
Yeah, and, I said, just it wasn't as busy I wanted, and I kinda wanted to, like, be your own boss.
Yeah.
And at this time, I got in the office I'm currently in as a consultant client, and I was there with 6 months, and then afterwards, he said, "Can you stay on?" And I said, Sure." okay. And it's, a little drive from my house, like an hour, but, it's a nice team. And then my school had closed because the girl that had took over for me didn't want to run it anymore. So
Oh,
doctor had closed it. So I stayed at Dr. Pugh's for a while, did some speaking, gauges. I love speaking, but sometimes it's not the right audience. Like doctors, it gives me like agita, like
yeah.
I'm speaking to the boss, like what if I say the wrong thing?
Oh, no, I can't wait to get a bunch of doctors in there. I'm just like, I got so much to tell you.
Yeah, 'cause you're working with their money, so they
Right.
wanna know all about it.
It's true. It's
They
true.
wanna know how to get more money in the door.
It's true. That's funny.
And then I had an opportunity a couple years ago, there was a high school program that was going from adult to high school, they converted it, and I ran that for 2 years, it was full-time, September to June, loved it. I loved teaching the high schoolers, whether they used it as a platform to get into being a dentist or a hygienist or be a dental assistant.
Mhm.
I just loved it because they were just so eager to learn,
Yeah.
and they didn't really have anything to go off of, like, "Oh, is this a profession for me?" They were just really and I think it's great because it started and put people into our profession at such a young age that,
Yeah.
"Okay, maybe I'll stay here for a couple of years, and then maybe I'll go on to be a hygienist or a dentist." And then they decided that they didn't have a lot of enrollment, that it wasn't a need, and I'm like, "What? This is
Mm.
crazy."
I know, I was so sad.
Crazy. So I'm
Yeah.
back in office full time. I'm speaking and I'm doing a lot of content. My favorite thing to do right now is to do product videos to help assistants because when we started, we didn't have the internet.
No, we sure didn't, and we were very suspicious.
We barely had a network of people to meet with.
Yeah,
We
exactly.
just figured it out. And if it was wrong, it was wrong. We had to do a lot of reading. We had to do a lot of research, a physical book, maybe.
Oh, definitely. Oh, I had a lot of physical books I was reading, and
Yeah.
we couldn't do, "Hey, Google, tell me about this." I was Google. You were
Yeah.
Google.
So now, I've been just doing product videos and instructional videos to help the assistant out that their doctor gets this product in, like these, my next product video, Zero by Dove, but gets
Yeah.
these in, that, oh, we're going to use these. Well, what do we know about them?
Yeah,
There's no instructions with them. How do I use them? Are they one time use? So,
yeah,
me having a sound source for instructional videos and product videos for assistant, it helps because it makes them better. Like, oh, I was always doing it wrong. And it's interesting on some of the videos, they'll be like, "Oh, that's how you use that?" Yes, that's how you correctly use it.
right, right. Yeah, who
Doesn't mean
knows how it's supposed
your
to go in?
doctor or office always will, but this is how it's technically supposed to be used and the time you cure it or, scrub it on the tooth or what's the
Yeah,
process behind it. Because sometimes we get products and doctors doesn't tell you what it does or why it does it. And
yeah.
it'll just be nice to know that for them
Well
for more educational purposes.
Well, your videos are very popular. I mean, tons and tons of views, and I love it because I would love to have in my office if my assistant said to me, "I always watch your videos. I always want to see what's up." Like that would make me so happy because I don't know enough to unbox anything by Dove. Like I wouldn't know. And you're right. Like a lot of times the doctors go to CE, they come back, and then I'm as an office manager and the coder, I'm struggling to figure out what are we doing with this? Meanwhile, in the back, you
Mhm,
guys are actually doing it. And there might be a book, there might be an onboarding class,
mhm,
there could be nothing.
mhm,
And so it's super important. And I think when I see that an employee is being resilient enough to go out and find the explanation rather than waiting for it
mhm.
to be given to them, I feel like I see that a lot in offices now where we would go out and get the answer because we needed it. And
Right.
I see a lot of people just waiting to be told, or they'll tell me when
Mhm.
they need to. That disappoints me as a
It
manager employer.
Yeah, and as one, I am technically like the business manager of the practice because I do everything. I'm walking out patients. Doctor loves when I treatment plan and schedule because clinical, you can explain things to patients. And I help out in hygiene. I have no problem going to grab their instruments or flipping a room for them. I tell my team, we don't have an office manager. I manage his bills and the payroll
Mhm.
and office supplies, but you are your own managers. Just do your job. If you have an issue, come to me. You need to be off, fine, figure it out, because I feel like I don't want to hover. And I
Yeah.
feel a lot of people are, what do you call those, micromanagers? And they don't need to be. They're a great team. They have their own thing that they do. As long as the schedule gets done, patients are happy, it's fine, and I know a lot of offices, people, "Oh, we can't call in or we can't do that." We all have kids, we have lives.
Mhm.
Work is not the only thing here. Call me by 7 o'clock, I'll take care of your first patient. So you have to be because life happens, and
Sure.
unless everybody in the office is a workaholic and wants to be there 24/7, then okay, but most people don't.
Most people don't, and it's good that you have that environment. It obviously comes from the top down. There's a belief that everybody's competent.
Mhm.
Obviously, you're getting sent to CE to stay competent.
Mhm.
I can tell you that some people listening are like, I don't have employees for 20 some years. I have new employees and I'm really struggling with, like, they're afraid to say, you just make sure it gets done because they don't have the confidence in that person to
Mhm.
do that. You are able to say that. The team I have in my office that I still, go do stuff for, they've been there a long time. I can say that. Gene can say that,
Right.
who's managing. What do you say to a manager, because you're a manager too, like, what
Mhm.
do you say to one of your colleagues that's like, "Well, that's all great, Julie, but I've got a new team and they're not gelling and all that." I mean, you've been in management long enough. How do you handle that?
I think it's systems, having systems and kind of not, "Did you do this?" I always ask at least once or twice, "Do you need anything? How can I help you?"
Yeah. Yeah.
I like them to tell me, or if they want to come up and say, "Hey, I need this done," or "I need this X, Y, and Z," because I think it makes them feel like their voice is being heard. If you are a pecker, that's what I used to call my old boss. At one time, he would peck, like, "Do this, peck at you all day long." And I'd be like,
That's
"Dude,
funny.
I got it.
Yeah.
I got it. Yes, I took care of the CEREC. Yes, I sent out the cases." You babysit your kids till they're 18. You don't need to babysit your coworkers.
Yeah.
Like, I think if we have good systems in place, good expectations of like when you need to punch in, what you need to do, what your roles and responsibilities are, I think that alleviates that stress and makes them feel like they are part of something great, like they're invested in it. And
Mhm.
so if you say, okay, well, I want you to take this course, great, I'll take it. What's the time invested? Where do I got to take? Is it online? I
Yeah.
think it just makes them feel valued. It comes down to feeling valued. My boss sends me a CD junkie too.
Mhm.
Every day he's texting me something. Oh, take this course. I'm like, dude, I don't got all that time.
I know, right? That's how mine was. It was actually, I'm grateful for it now, but there were times when I was
Right.
like, "We have to, like, make some money first. Like, we can't constantly be out doing stuff, like, it's kinda nuts."
Mhm.
Okay, you've also seen a lot of younger people come through, obviously, that's who's coming
Mhm.
through. All I hear from dinosaurs is, "These young people nowadays, they don't wanna work. They don't," I mean, whatever it is. So, I mean, I think they probably said that about our generation, "We don't wanna work," right? Are you hearing about that often from your students that, like, they're not taken seriously because of their age?
Yeah, and I think we're hearing that because I feel like some of the younger Jays, not all of them,
Mhm.
feel like with all the social media, they're entitled.
Yeah.
Well, I'm just going to get on social media and make lots of money. It's a lot of work. I could not do a full time because nobody's paying me what a full time salary is in an office. But anything you do, even the social media that people that are like, oh, I'm just going to be a content creator, it's a lot of work. It's a full time job coming up with something to script and video and
Oh,
edit and
sure. Yeah.
then wait for 100 views.
Yeah,
And then
right.
you don't hit on 100 views. So I think a lot of it stems from the entitlement that well, I got this job. I'm here working for you. But
Yeah.
also, there's a lot of good ones out there that are on time. They have good work ethic. They want to
Mhm.
work, but then they're not given the tools and they kind of lose interest.
Yeah.
So I think it's one hand washes the other. Like, what are you doing to make sure they're up for success? And are you hiring somebody that wants that? Or are
Mhm.
you just hiring a warm body just because you can't find anybody else? But
Yeah.
you should still have systems in place and treat them like, hey, we want you here. We want to help you, not just, oh, you're just here to assist for the day.
Yeah, and
So,
I do feel that there's a lot of, we can get anybody to be an assistant. We just need a
hmm
warm body, right? So I
yep.
do hear that. I can train anyone to be an assistant. And there's
hmm
instrument there because, I mean, yes, there's CDA, RDA, FDA. There's all the certifications, but the
hmm
majority of dental assistants are trained on the job because
hmm
the states have not moved to a point where they're mandating, like real qualifications to be an assistant. I think that's sad, but I also understand that helps people continue to come into the industry. Are you
Mhm.
torn about that like I am? Or, I mean, how do you feel about that?
Torn about it to the point where I think because some people feel it's not valued as a recognized profession. We're
Mhm.
not the hygienist that went to school for a little bit and has to have a license. They
Mhm.
can't do anything without having a license. Okay. And
Yeah,
it's a free for all for some states for dental assistants.
yeah.
I mean, I read through some of those. I'm on my state's board and I look at like what I can do legally being licensed and what other states can do not being licensed. And I'm thinking, there's no way. There's no way. So I think it stems from it's really not classified as a true healthcare profession
Mhm.
because we're not mandated to be licensed to do things in someone's mouth, in their little cavity of a mouth, where a nail tech has to be, a dog groomer has to be, a
A dog
CNA.
groomer too? Really? I didn't know that.
Yeah, well, in the state of New York, yes, you have to. We are the only not mandated profession to be licensed.
What the heck?
Yeah, like you
Really?
can't touch a dog, groom a dog in New York State without being licensed.
That's amazing and
Mhm.
disappointing.
But yeah, a dental assistant can be pulled off the street and in your mouth the next day.
Right, and that's terrifying on itself, right? But you do have to have radiology certificate. No? Okay.
No. So in New York State, there's two classifications of dental assistants. There's the unregistered, which can do like basic supportive systems like pass instruments, setup, breakdown. We can take radiographs as long as they're wearing a thyroid collar and a lead shield because it's still a public health law. People don't get all your panties in a bunch. So I'm saying that it's a public health law. We have not changed it yet.
Yep.
And they can do, suction and retraction, but they cannot do ortho. They can't do suture removals. They can't take impressions or scans. So we do have a list of registered functions that
Okay.
you have to be technically. Now, are there? I mean, when I look at my state stats and there's like 8,000 dentists and only 1,500 registered dental assistants,
Yeah, that's a
are they all? I'm sure there's some out there not doing what they're supposed to be doing.
yeah.
Trust me, I'm one of them. I used to do it a long time ago. So, our state, that's the way it goes. But most states, it's like, it depends. Like, are you in Virginia?
I'm in Virginia, yeah.
And out with the OPA.
Well, and there's one school that was teaching it, and I think they're about to get rid of the program. Like not that, I'm talking about the level 2 DA. There was a level 2 DA that they passed,
Mhm.
and I mean, it's like it's a unicorn. I've never met one. I know we graduated a couple, but I've never met one, and I believe the
Mhm.
school I might be wrong, but I think the school they were talking about shutting down the school that offers the DA too. Yeah, but now we've got the OPA. What does that stand for again?
Oral preventative assistant. So,
Yeah.
what it is some states are passing laws that with I don't know if it's rigorous, maybe a weekend course, a new type of curriculum, maybe trained on the job, is that the dental assistant can be allowed to scale
Mm.
above the gum line, above the gum line and polish. My issue with it is first, assistants need to know the difference between polishing and a prophy
Yeah, there's
because
yeah.
until they know that difference, I've been in a couple forums where I've had dental assistants be, "Oh, well, I polish all day long and do prophies." That's not a prophy code.
2 different
Polish,
things.
they're two different things.
Yeah.
And also, things don't just set above the gum line.
Yeah. Yeah.
So it's a little, I think it's just so wonky. I think there's some dentists out there that really see the need. I do think there's dentists out there be like, "Oh, I can cut payroll in half by giving a lesser role to the dental assistant and paying her a little bit more money to do it." So,
That's the
and
unfortunate part. I mean, because I could see maybe a pediatric dentist thinking, "Okay, fine." But you're absolutely right, though. If there's calculus, like, if it's going under the gum line, like, she's gonna show
mhm,
up, and will she or he? And if I were an assistant, I don't know if I would be comfortable with this
right.
new requirement. And, like, I've talked to a couple people who are in Minnesota, and,
Yeah, and
they're
they
like,
got
Are you
They are a great state because all their assistants have to be
They
licensed.
have to be licensed, but now they have the ability to go get anesthesia to do
Yes.
certain types of anesthesia, and
Mhm.
the people I know who have assistants, I'm like, "Are your assistants going for it?" And they're like, "Assistants don't want that responsibility." Like,
Right.
that's a lot, and, I mean, they do have classes you have to take. You can't just start
Right.
injecting people, but
Right.
no one has said, "Oh, my assistant's stepping up and doing it." Assistants are like, "Whoa, wait a second." But
Mhm.
I don't know, I feel like I would be nervous because there's liability now, like, I'm injecting, now there's liability, and that's not
Yeah.
quite what I signed up for, as an assistant.
And I do think there'll be the assistant be like, "Oh, no, they want me to do more for less," than
Mhm.
paying the hygienist. And there'll be the assistant that the doctor will give them that carrot and dangle it out front, "Well, I'll pay you $10 more an hour." And if I'm young, between 20, 25, I'll be
Yeah.
like, "Okay, sure."
Yeah. Yeah.
Because I know I did it when I started out my profession. I didn't know I wasn't allowed to take impressions, do ortho, remove sutures. I wasn't even licensed. I was like, "Oh, you pay me more? Sure. You want me? Sure." And then I started reading my laws. I'm like, "Yeah, I'm not allowed to do that."
Uh-oh. Uh-oh.
I've been
Yeah.
doing it for years,
Yeah,
you
you're
know?
probably really good at it too,
Yeah.
right?
I was competent. Our assistants competent to go through a program to learn how to properly scale teeth? Absolutely.
Mhm.
But I think we're getting away from the purpose of why it's there in knowing that it's supposed to be for lower income or access to care. But there'll be a dentist out there that has a Taj Mahal practice that's just like, I'm going to hire an assistant so I don't have to pay the
No,
hygienist,
you're
you
right.
know?
You're right. I can imagine already there's former clients and people. Yeah.
How are you gonna mandate or how are you gonna oversee all that, you know?
That's a whole thing. I mean, I know dentists right now who are supposed to go in and do hygiene checks, and they'll basically say, "Is everything okay? Yeah, fine. All right." And then they write down that they went in, and they didn't. They didn't go in.
And then they're billing out the exam.
Absolutely, absolutely. It's the wild world out there, and I feel bad when I talk to dentists who are honestly doing the right thing, and they're like, "Why
Mhm,
am I having to do this, and why am I having to do that?" And, part of it is, yeah, the insurance carriers have a lot of rules, and unfortunately, it's getting more
mhm.
complicated, but the other side of that is that you have a lot of colleagues who are doing shady stuff, and I'm sorry. It's true,
And
and
a lot of
I think it's getting
non-colleagues that
worse.
are yeah, and a lot of non-colleagues that are doing shady stuff they're hitting the news now. I think the public is being more aware of what goes on in their mouth and who's doing it.
Mhm.
So, I think it might come around to someday where someone goes into a dental office and a dental assistant is doing something and be like, "You know what? I really like to see your license."
Yeah, I think that's definitely coming.
I don't have a license. Well, I know that you are supposed to be licensed to do ortho in New York State. Where's your license? It's not
Mhm.
hanging.
Oh,
So it might
yeah.
be coming where a patient might ask to see a hygienist license. And I've known for myself, taking impressions or placing a matrix. I've cut a patient here or there, and I'd be like, "Oh, I'm so sorry." In the back of my mind, I'm thinking, "Oh my God, am I going to get a board complaint? Like, I'm licensed to do this now, but my license hangs there. So
No, you're right. I think too, people love to bring in the camera and
uh,
videotape and all that. I mean, we
mhm,
really just a little bit away from something like that happening, and it'll be some poor unsuspecting assistant with a doctor who
mhm.
does know the rules. But going back to the laws, and do you feel like it's gotten better in general with state laws, or do you think we still have so far to go still?
I think we've barely scratched the surface.
Wow.
I
Okay.
really think that, and I know Danby, the Dental Assistant National Board, has come out with like three models. Their professional working dental assistant model, where it has three different types of levels. I think it's going to have to take something really major to happen for all states to be aligned. Because if you go from my state to California, California has five or six things a dental assistant needs to be licensed with.
Yeah.
Minnesota, you have to be licensed to be a
Mhm.
dental assistant, chairside. Boston, you have to be registered as an unlicensed dental assistant or a DA1 or whatever they call it. Or for me, for my credentials, I'd be a DA3. So,
Mm.
I mean, New York State, you just be trained on the job to do a couple of things,
Yeah.
if they just want a supportive role. So I think it's going to have to come down to where they really want to have a national standard where you have to go to school, whether it's for 6 months, 9 months, a year, whatever the case may be,
Sure.
and get registered and licensed in order to practice chairside. And it's funny because I always thought there should be, and I was talking about this with a couple of other dental assistants and a hygienist. I said, there should just be no, not even a dental hygienist anymore or a dental assistant. We
Oh,
should
no.
have, listen, a dental auxiliary, national, you're a dental auxiliary, and you are go through a 2-year program, get a
Okay.
degree, and you can either funnel into hygiene or you can funnel into chairside.
Mhm.
And just like nursing, when you set out to be a nurse, my sister's a nurse, she's a traveling nurse. She's an RN. Everybody's classified as an RN.
Right.
And she can go work in labor and delivery and get a special thing, or she can go get a certificate in this type of thing, like the next step up. She can
Okay.
get more credentials. So she's a labor and delivery nurse, or she might work in OR, or they have these little initials after their. So
Mhm.
you can have a dental auxiliary that is an RDH, or a dental auxiliary that's a CDA,
Yeah.
but they have played all the same roles because eventually the two might just happen to be together,
Well,
because
and there should
there's
be a
no
base level
necessary.
of knowledge, right? Don't you think? Like, there should be a base
Mhm.
level of knowledge, and I know a ton of assistants who can run circles around hygienists and vice versa, but,
Right.
I mean, that's kind of interesting. So, yeah, you would come in as dental auxiliary, clinical auxiliary, and then you can go down this path, or you can say, "Okay, I wanna do a little bit more subgingival, systemic," so you become a
Right.
hygienist, you do that.
Mhm.
And ortho assistance is a totally different thing. Surgical assistance, totally different thing. And then
Oh,
now we've got assistants for sedation dentists too. So, I mean, you're right. It's not one size fits all. That's an interesting concept, Julie.
it isn't one, if we made a national standard, like, they have CNAs and MAs for medical assisting and stuff.
Mm-hmm.
But really, if you want to be a nurse and work in different branches of medicine, you have to get these little level ups or whatever you want to call
Sure,
them.
sure.
But for dental assisting or dental auxiliaries, because I know, like my hygienist, if I'm not there and Heather Lee has to call in, we cancel my hygienist schedule and she goes back and assists the doctor. And
That's
she can
funny.
do that just
Yeah.
fine. And she can actually get the patient numb. Look at that.
Oh,
Like,
that's amazing. Yeah.
not that she does, but I think our standards, our national standards, in order to have dental assistants feel like this is more than a job and it's a career, there
Mm-hmm.
has to be some type of national standards coming. There has to be a mandate, but it's so hard to get dentists on board because it's all different.
It's all different, and you and I know the politics at the state
Mhm.
board level is just depending on the state, can be exhausting, quite frankly. And so when Stacy was on the podcast, she teaches EFTA, and
Mhm.
she says she has hygienists coming through who are getting their EFTA as well because the hygienist can not only get the person numb in her state, but now if the dentist is like, "Hey, we just need this one small thing done," and she's able to do it, to get
Mhm.
the tooth ready and prep and all that. It's wild that now this
Mhm.
hygienist has become like a super producer. And so the dentists who get it, they see the value in having those two different and you wouldn't think because the one I did see a question on a forum, why on earth would a hygienist become an EFTA? And I thought, oh, you just don't know. Let me tell you. And then,
Mhm.
sometimes I don't know if you do this too, but I go to reply and then I just erase my reply because I just don't want to get into it. So I just don't. So
Yeah,
I had this whole thing
I do that all the
all
time.
the time. And I'm always like, I do. And I had this struggle inside, like, I'm an educator. I need to educate. And then I think to myself, Teresa, the last time you did this, somebody said, well, I don't know who you think you are. And I was like, okay, I'm
Oh,
out.
all the time,
Yeah,
time,
exactly.
all the time. I just actually posted a video, and I think it was on Michelle Strange's. I asked her, "What's one infection control no-no that you see dental assistants doing?"
Hmm.
Now, if you know me, my page is geared toward the dental assistant audience.
Uh-huh.
If a hygienist comes over on it, sure, if a dentist, but I really want it, it's very
It's
pertained to dental assistant. I am a dental
absolutely.
assistant. I'm not a hygienist. I'm not a dentist. And, I had 2 comments. Why has it always got to be about the assistant? It wasn't. I'm like, hello, welcome to my page
Right.
where I talk all things dental assisting. I'm
Thanks for
Julie. I'm a
stopping
dental
by.
assistant. Thanks for stopping by.
Wow. That's all I can say.
And I'm like,
It's a wild world out there, it
"It
really is,
is."
and I remember, like, if somebody disagreed with me before the internet, if somebody disagreed with me, they talked to me about it. Now they just leave a comment, "Oh,
Yeah.
whatever, it's fine." It's fine. It is what it is. We have thick skins. You and I have been doing this long
Yeah,
enough.
and that's one of the things that speaking of thick skins is we were talking about it with another assistant in a group, and I said, "In order, don't complain if you can't fix it, if you're not willing to change and fix it, but also in dentistry, from the dentist to the hygienist to the front office to you have to have thick skin.
Yeah, oh,
You
yeah.
have to learn how to be a people person, how to deal with people, not so much a people pleaser, how
Mhm.
to solve problems if someone
Mhm.
has an issue with you or a patient does. You have to really learn and you have to not let it bother you. I mean, I used to, and
Absolutely.
I'm sure you did too. I'd go home and be like, oh my God, I'm never going back.
Right. Oh, yeah.
That
Yeah.
patient made me cry. I literally 6 months ago, maybe 5 or 6 months ago, the Heather Lee had to be out. And it was first of all, I hate root canals. I will avoid them at all costs. I
They're
just
very
don't like them.
boring. They're boring. I feel the same way. They're very boring.
And a patient came in the chair and he hates me. He literally hates me. Why does he hate me? Because I made him pay his bill one day.
Oh gosh, how dare you, Julie.
How dare me?
Wow.
Ugh. So he comes, he goes, "What are you doing here?" I said, "I'm the assistant today." He's like, "Oh no, he hasn't fired you yet." Like literally he
Oh my
told
gosh.
He's telling and I said, and I know how to, like, charm people like that, and I'm like, "Oh, you're so funny."
Look,
I'm like, "Well, you can work with Doc all alone through this root canal. It might not be pretty, and it might take a couple minutes longer."
a lot of minutes.
And then he came in a couple weeks ago, and I went in there and I said, I called him back and he goes, "I'm not coming with you." I go, "Yeah, I'm gonna clean your teeth today. Don't you know I do that?" I was joking. But he's like, "Oh no, I still don't like you." And I'm like, "That's okay. I don't like you either." Like,
There are some patients you can say that to. I know
mhm,
it. I know it. It's fine. But yeah, if you're starting out, I get a lot of new people listening to this. If you're starting out, a patient's going to be totally mean and you're going to think, oh my
yeah,
gosh, I'm never doing this again. That person's probably totally mean to everyone, not just you, right? Like grumpy people are not just grumpy when they come in, they're grumpy all the time. So
yeah.
it is what it
They're
is.
just complainers. They're just Sally sourpusses. They're
Oh,
Debbie
yeah.
Downers, and they're not just like that at the office. They're like that in life.
Yeah. And,
That's just who they are.
and
They're just who they are.
And you can't let them see you sweat because
No.
they're always going to be like that with you. If you're always
Mhm.
happy-go-lucky, and that's really the only way to handle one of these, like, grumpy types is just like, "Oh, yeah," and just la, 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 and let them just be grumpy, it's fine.
And I've learned, and I try to tell the younger ones, that get frustrated, you just have to dose it back. You just have to give it back. Like the other day, Heather Lee and Doctor were in, and I knew her room was dirty because I know what goes on in the office. And and
Mm.
I was getting up, and he goes, "Hey, that room." I go, "You don't need to tell me what to do. I know what's going on." Whoa, and I'm like, "You don't need to tell me. I know."
Yeah,
"Oh, I just want to make sure, and I'm like, "Mm-hmm." It's a control thing
yeah.
that, so you just have to kind of give it back in a funny way manner. But if
Mhm.
you know you're doing a good job and they're constantly riding you, start riding them back. Like,
Yeah,
chop chop, let's go.
yeah,
You have to have thick skin. You
yeah.
do.
Well, and this industry the changes and I know we're getting close to time here, but the changes have been so fast. I mean, you and I think the biggest change in our early career was switching to digital radiography.
Oh,
Really, like, that was huge, right? And then, like, changing from the paper appointment book to the online schedule was traumatic, right?
oh,
So
it was.
but
It
now
was.
look at us. We're doing
Well,
scanning, CBCT, AI
yep.
and imaging. Like, now I'm like, "What else you got?" Like, I just am expecting something
Mhm.
new and innovative all the time, and I don't know, I think we're so used to the really stepped up pace of change,
Right.
so
Right.
it doesn't bother us anymore. But now I'm seeing dentists coming out of school and they're like, "Oh my gosh, how do I keep up with all these changes?" And I'm going, "Is it tough?" Like, because I just feel like we're handling it because we've seen so much. And like for
Yeah.
me, integrating the intraoral camera was probably one of the hardest things to do in our office because it was you want to talk about a whole workflow shift. That was it. And then of course the digital radiography. So for me, like if you throw
Mhm.
AI on the Is it just gonna be on the screen? I don't have to do anything different? I don't have to change out a cartridge? Oh, yeah, okay, this is easy. Like, that's how I
Mhm.
feel now, you know? You and I have just seen so much. What are you excited about coming up in the industry?
Right now, and like you said, growing and evolving is 3D printing is like
Mm,
how much, and it's been up for the last couple years, 2, 3 years maybe, and it's starting now to be really prevalent in,
mhm,
the field. And I'm like, I told Dak, I'm like, we're buying 3D printing. I'm like,
nice.
I can do this myself.
Yeah.
I can do this. I can save us money because it does save a bunch of money than having
Mhm.
someone else do it. And I said, we scan everything. We don't take impressions. We can print the models, send them to the lab. I said, it's a good thing. The 3D printing I can see coming up, and get your assistants doing it. There's
Yeah.
nothing worse with technology. I remember when the red cam came out for CEREC. It was
Oh,
red.
yes.
It wasn't all red, but the lines were red. They called
Mhm,
it the red cam. And I remember it sitting in the corner, and I knew it cost a lot of money. It looked like it, right? It's like the Apple computer. You bought the
mm,
Apple and you're like, "Oh, wow, this is a lot of money." And I said, "Are we gonna use it?" "Oh, yeah, we gotta take course." "Well, let's take the courses." And we started using it. And now, if you are not engaging your assistants in all, like, learning all they can do so you can go be productive doing something else,
sure.
you're missing the boat.
Oh, yeah.
You are really missing the boat of having them. Don't hog that CEREC. Don't hog the printing or the milling or
Yeah.
designing. Get them involved because one, it's going to make them better chairside.
Mhm.
And two, it's going to make them feel like they're part of the process,
Of course. Yeah. I mean, your hourly goes up if you're really
Mhm.
utilizing your auxiliaries in the correct way and to the most of their abilities and their license. I mean, of course, and their,
Right.
to the statute.
Right.
Don't do anything shady. But I think that's seriously very valuable advice because a lot of doctors do feel that when they bring on the assistant, like, okay, the assistant, I'm going to do this and then I'll train the assistant. But I always
Mhm.
hear from vendor reps, if I can get the assistant in the training, then this doctor is going to use this. And that's why
Yeah.
for high tickets like the lasers and the CERECs and the scanners, if you don't bring the assistant, they are nervous that the doctor's not going to use it and then the value's not going to be there. They may want to return it. So assistants are kind of the secret sauce when it comes to that. And
Yeah.
vendors know that.
I do have to agree that when you go to invest in learning anything, and I had, when I worked at my old practice for 26 years, he would go to all these things, never bring me. And then he would come back and I called it regurgitate it
Mm,
because he would throw it back out at me. Half the information was missing,
right.
half it wasn't correct. The steps he'd give, and I'm like, all right. And after he did a couple times with that, with like, we started doing implants and the CEREC started, changing and evolving. I was like, nope, I'm coming with you because I want it
Yes.
firsthand and
Yes.
want to know my role. So when I went to work at this new practice, he's like, I really like to do implants. I'm like, well, what implant system do you want to do? So we're doing BioHorizons. He's like, but I want to go through, I think it was like Mish Resnick at the time.
Oh, yeah.
I said, okay, well, I'm going to every single one. There's 6 classes. Out of all of them, I think each class maybe had 2, 3, and they were packed. They were weekend, 2 or
Mhm.
3 assistants. So now you're juggling all these parts and pieces and knowing how to when, and you've left your assistant out
In
that is
everything.
working the surgical sterilization process, and knowing what to do with implants and not what to do with implants. And I'm like, yeah, how come
I
well, they didn't want, well, you make them want to come.
Yeah, and
Like, you don't
also
offer it like, hey, we're going to this course and I think it's gonna be great and you're gonna go.
and a
You
lot
know?
of doctors are like, "Oh, well, then I have to pay for them to come." Yes, you do, but
Mhm.
exactly what you just said is going to happen. I saw this a lot when I was with ICOI and they had their ADIA training program, auxiliary dental, oh gosh, it's been so long since I've worked with them.
Implant. Yeah.
Association of Dental Implant Auxiliaries, that's what it was. And I helped create the implant coordinator program, but there was an implant dental assistant program full day. I took it and I was like just my head spinning. And it
Mhm.
was because my doctor was learning implants at the time, and I cannot imagine having helped him be successful without having taken any of those classes. If he had
Mhm.
come home and said, "This is what we're doing," what a disaster that would have been. And I mean, the whole parts and pieces, this is why doctors they get the implants in the office and they're like, "Oh, she threw away this and she threw away that." Well, yeah, because she didn't know. Like, parts are expensive. You probably need to tell her that.
That and there's no organization for them.
Yeah,
I've seen a couple question forums. How do I organize my implant system? And I'm like, well, did you not go to the class? Like,
probably not. Probably not. So,
but that's in the newer dentists that are coming out, we as dental assistants have to realize that they probably never worked with an assistant when
yeah.
they get a and how can we help them and not complain, "Oh my god, it takes them 4 hours to do an occlusal." Well, they're
Mhm.
doing it without an assistant. So how can we speed up the process if we sit down and go through the process with them of what they like, when they do what? I mean, because dentists are little robots. When they
Yeah.
learn how to do a composite,
Do it
they do it the
over and
same
over and over again.
exact way the next time.
You
They're
know,
just programmed.
that is interesting, and this is the last thing we have to talk about because my editor's gonna be like, "What the heck?" Here's the thing, there used to be the doctors would come out and there would be assistants, and four-handed dentistry was the norm when you and I started,
Mhm.
and it is a beautiful thing to watch when they are really when
Mhm.
they're in sync. So I know a lot of the schools don't have the dental assistant schools like they used to. They're mostly coming out with no dental assistant experience, the dentist working with the dental assistant. So are they even is
Until like
four-handed dentistry still going on out there? Like,
yeah,
who's
yeah, no, it is. I
okay.
just know that there are some, a lot of the sim labs they call them or their lab clinical days, they don't have assistants. They don't learn how to work with an assistant.
That's so
There
sad,
should
like,
be a
that's like
there should be a program one semester you have to learn how to work with an assistant.
that's how you make a dental dentist faster and more efficient. Why is that
Mhm.
missing from the curriculums?
I
That's
don't I don't know. I
mind-boggling.
know I ran into a couple newer dentists at the Chicago Midwinter and I'm like, "Oh, when you get out working with your assistant, I beg you to sit down with them and go through everything you want to do, whether you don't want to do a root canal, you don't want to do an extraction, so they know if an emergency patient comes in and they need a root canal, you're going to refer them out. They're not going to
Mhm.
waste your time setting up. Or you like your composites and what way you do it. Do you etch or you, whatever you do, they know how you like it because it's going to make your life. You're stressed anyways, being chairside live for the first time,
For
being
sure.
licensed.
Oh,
And
yeah.
now you have to help your assistant through this process of what you like. But if you don't tell us, we don't know. And I
Mm.
met this really nice one. She was a 4th year, and I think she's in tech her name's Razzle. Maybe she's in Arizona at the Chicago Midwinter, and she's gonna go work in her mom's practice, but I was like, "Just sit down with them. Take a half a day and sit down with your assistant and work through all the procedures you like to do and lay it all out, take pictures,
Oh,
work through
yeah.
that process.
Yeah.
'Cause it will make her life easier." And she's like, "That is a great idea." And I said, "You're going to your mom's practice, so I'm sure you have a little bit more pull of
Yeah.
like, hey, I need a half day to work with my assistant."
Yeah.
And I said, "You know what? Coming from an assistant, I would be like, whoa, you want me to, I would be so like, oh my gosh, yeah, I would love to sit down
For
for half
sure.
a day.
Yeah.
I wouldn't feel so stressed about meeting you and knowing what you want because I can't read your mind, you
There
know?
is no program out there, Julie, for veteran dental assistants to put like a boot camp for new dentists, like how to work with your dental
I don't
assistant?
know, but we should. I should.
Yeah, Julie, why not? Because I mean, I'm being serious, like, because I do talk to dentists. They don't know how to hire a dental assistant because they just figure the dental assistant's gonna put stuff on the tray. They have not had that interaction. And
Mhm.
it's not
Nope.
four-handed dentistry, it's really more like handing. When I say four-handed dentistry, there's a video that I have in mind, I'm gonna put it in the show notes. It is a gorgeous it's like a symphony playing, the conductor, like, the way she
Mhm.
has it in her and that's how I learned, like,
Yep.
my pinkies were holding this, and this was holding this,
Yep.
and I just don't think a lot of doctors have had that before. You need to do this, Julie, like, this is like a mandate now, right, for
I'll get
dentistry.
with Miss Cherie and, we're
Yeah.
doing a dental assistant palooza day. Maybe we can have, like, a new dentist day,
Yeah.
how to work
Yeah.
with your assistant because it really is important, and I love the new dentists. They're eager, they just got done with school, they have all this debt, and they
I know.
wanna work, and they wanna try all this stuff, so I like the new dentists because they're the breath of fresh air,
Yes, for sure,
They're
for
not
sure.
on their way out. They're not crotchety or cranky sometimes, but, they just don't understand how to work with an assistant or how to hire an assistant
Sure,
or,
sure.
what can I do better to keep them, just
Mhm,
don't complain and let's figure it out.
mhm.
Are you a dental biller feeling overwhelmed and isolated? I get it. The world of revenue cycle management is complex and ever changing. That's why I created Dental Revenue Network. Our membership community was created to help you become a better revenue cycle manager and small business operator. Say goodbye to feeling alone and hello to a supportive community of dental billing professionals. Here's what you'll get: monthly billing focused meetings with peers and experts, business building sessions to elevate your career, resource libraries tailored for billers and billing company owners, introductions to cutting-edge RCM technologies and companies, and a vibrant community for networking and support. Ready to transform your dental billing experience? Visit dentalrevenuenetwork.com today. Don't wait. Join us now and navigate the business of RCM with confidence.
Yes, gotta
So,
work together. So, this has
yeah,
been so much fun. Thank you so
it
much
has.
for
Thank you
giving
so
us
much for
the
having me.
the dental assistant point of view, and I'm so sorry that it had to happen, like, after we run into each other after years of not seeing each other. So, I was so thrilled that we were able to connect Chicago, and we'll have to have you come back on, and let me know if you are putting on any classes for assistants or anything like that. I'll make sure people, my readers in my newsletter and all that know about it.
Yeah, we have a class coming up August 14th in the Patterson branch in Atlanta.
Okay.
Cherie and I are putting a dental assistant palooza day together
Look at that.
where we have there'll be a topic every 45 minutes.
Oh my
So
gosh, yeah.
it's not the same thing all day long. It's kind of like a melting pot of dental assisting, as
I
she
like
said.
that. Are you
So
gonna take this on the road? Is this, like, something that's gonna be
yeah,
around the country?
she wants to, she's just putting herself out there as a speaker and stuff. So,
Mhm.
she's very, very knowledgeable. She's a great speaker. I saw her speak in Chicago and,
She's fun.
last year and this year and she has a lot to say as a seasoned dental assistant too. There's a lot of good
Yeah.
information she has to say and share.
And you'll be at Chicago Midwinter next year?
Yeah, I'll be
On the
speaking there.
Speaking
My
there, I'm
first
so happy
time.
for you.
Oh,
Yeah,
thanks.
yeah, so
We'll
and
see how it goes.
I'll see you there. I'm not speaking next year, but I always go. It's one of my favorite meetings, so I'll go in. I won't heckle you,
Yeah.
but might take some pictures.
You can come in and heckle me.
But well, thanks again, Julie, and I'll put
Thank
all your
you so much for
information
having
in yeah, and in the show notes and people connect with her social media. The videos she puts out are super you might wanna just forward it to your assistant and see. She probably is already watching. But again, thank you so much. We'll make sure
for
that
having
everybody
me.
can connect with you. And dear listeners, as always, I appreciate you spend your time with me.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.